Ever looked at a massage menu and feel totally overwhelmed by all those different massage styles? There's Swedish, deep tissue, sports, Thai, there's hot stone in some places, there's even moon massage. What do these all mean, right? So let's dive into what these different styles are, where they overlap, where they're different, how to tell what might help you and what might not. And then we'll talk about why we don't even have these items on our menu at Bodyworks DW and just offer you 60 or 90 minutes. So let's start with the most common, super classic Swedish massage, and then there's also deep Swedish. So let's get into what that means, a little bit about its history, and what you can think about it being for you, and why you might like it or not like it, and what you might get out of it or not get out of it. So the reason it's called Swedish massage is it was invented in Sweden in the late 1800s, early 1900s, and it was what you think of when you think of massage on TV. A lot of fast strokes, some kind of tapping stuff like this, some compression things. And it's really meant to be an overall tonic for your body. It can get into spot areas and can do some focus work, especially with more of the deep Swedish styles. But in general, it's meant as a full body experience. It's meant more like an oil change is how I would term it, like to use the car metaphor. In general, it's really good for relaxation, stress relief, and overall health. So, a couple of different things about it, right? It did start in Sweden. Weirdly, all of the terms that you hear, effleurage, tapotement, masseur, masseuse, are all actually French, because the originator of it migrated to France and developed the style there, and that's where it became popular. So all the terms that you hear from it are actually French terms, not Swedish terms. It's super normal to have a Swedish style in spa settings. It uses a fair amount of oil. It's generally light to medium pressure. Deeper styles can be deep tissue, and it can cross over into what we think of as deep tissue massage in deep Swedish. But in general, it is meant to be more of a broad health style. What it's not necessarily going to help you with directly in such a focused way is something like a rotator cuff tear, or recovering from a knee replacement surgery, or any of those more medical styles. You might find a practitioner who is good at those things, who was trained with Swedish styles, but in general, they're going to be incorporating a lot of other styles to try to accomplish those things in their work. And that is also going to be true of most massage therapists, is nobody's going to be stuck in just one box of, I only do Swedish, I only do this, I only do that. But in general, if you see on a menu Swedish massage, what you're going to get is a full body massage, light to medium pressure, a fair amount of oil, generally a little quicker strokes, not very slow, and mostly broad general relaxation. So then we have the next main thing you'll see on a lot of menus, which is deep tissue massage, which is a very broad bucket and can include deep Swedish, and really kind of covers the gamut for anything that essentially applies more pressure to the body and involves styles that involve more pressure, more intensity, more feelings of discomfort in the work and not feeling as good, right? And so you may have deep Swedish is one form of deep tissue massage. You also could have styles of sports massage that are underneath the umbrella of deep tissue massage. You could have styles of trigger point massage that really qualify as deep tissue. You could have some styles of medical massage or myofascial release that all would be under the umbrella of deep tissue. But in general, anytime you hear deep tissue, what you're really looking at is somebody who's going to be using more pressure, trying to get at deeper tissues, thus the name, And that generally can mean that you're gonna get more focused work on certain areas, but not always. So it really still can depend on the practitioner's experience, their training, which of those sub-styles they're actually applying. So if somebody's just doing deep Swedish, but they don't really have as much training in neuromuscular or structural integration or myofascial release or ART, there's a whole bunch of names I could throw out here, then again, it might be deeper and it might get less comfortable on the table. It might last longer. It might help you recover if you're hard, somebody who works out really hard, but it's still going to be a broad general session and not like meant for something like recovering from a knee replacement. You can obviously find practitioners. Let's say you go to a place and you sign up for a deep tissue massage and you talk to your therapist and you tell them that you're recovering from a knee replacement. If they have good training and experience, they will tailor that session such that they will do good focused work on the area with different techniques and styles so that you will get what you need out of that session. But you can't assume that from the menu item on that you're getting at the place that you go. You're going to have to actually do a little bit more research on the practitioner themselves, learn about them, talk to them, maybe call the place, ask, hey, I have this condition. Who do you have on staff who's comfortable working on it? That's probably a better approach than just trying to research all these different styles and really try to choose the one that works best for you. A little hint about why we don't have these menu styles on our menu at Bodyworks DW. Okay, so there's that broad umbrella of deep tissue massage. Let's go sideways from that into sports massage, which has very specific definitions in the realm of how we talk about it as practitioners, which has almost nothing to do with how lay people use the term. So let me define both of those things so that you can get an idea. So true sports massage, the way that we were taught in school, is the kind of thing that you do for athletes before an event to prepare for a race and after an event to recover from that. And that being the case, you actually do not want to do a lot of deep work, right? If you do a lot of super deep tissue work to somebody right before a marathon, they're going to hurt and they're actually going to suffer in their performance. And so the goal of sports massage from our perspective is actually light work. It's very fast. It's just meant to warm up the tissue and prepare somebody to go and actually do something difficult and demanding. And then after the event, it's also very light, very fast, just to help flush all the tissue and kind of help them recover faster. That's what I was taught in school and what most massage therapists would consider sports massage to be. Now, the way the clients use that term is really synonymous with deep tissue massage. Right? When I hear somebody say, oh, do you do sports massage there? What I really hear and translate that to is, do you do deep tissue massage for athletes? And the answer at Bodyworks is, yeah, absolutely, we do that. And we do lots and lots of it. But they're really not the same thing, right? And so you absolutely can do deep work for athletes between races, right? Like when they're training, and do deep work so that they have time to recover. But you wouldn't want to do a lot of deep work the day of a race, the day before a race, the day after a race, because it could actually make you run slower, right? So just want to make those real distinctions. This is what it actually means in our work. This is how people use the term. As therapists, we definitely filter when clients say, do you do sports massage, through that filter. So I usually will interpret that as deep tissue massage. Okay, so next style is trigger point therapy, which is also synonymous with neuromuscular massage. Those two terms are the same thing. And that is a style of massage that was developed by a woman named Janet Travell, who is not a massage therapist. She was actually a doctor, a cardiologist of all things, who was getting a lot of false positives for clients coming in complaining about chest pain and thinking they were having heart conditions, heart failure. And what she found in and then they would do scans and realize, no, they're not having a cardiac event, but they are having some sort of pains here that mimic the kinds of pains you would have when having a heart attack. And she sort of investigated and got really curious and found little knots in the pec muscle over here that are trigger points. And she found that when she pressed on them, the client's pain would go away, right? Thus, trigger point therapy. And she got interested in that and got much more curious and started looking all over the body for these trigger points, and found that if you press into them for 30 to 90 seconds and slowly wait and they soften and the pain diminishes, then clients get a lot of relief from that. And so she developed a book with a map of all of these different points on the body, which of course, if you go look at the map, your points might not be exactly where they are on the map on the book. From person to person, they're going to be slightly different, but the maps on the book do give you a good guideline for where to start looking for your particular trigger points. The other thing I would say about your trigger points versus mine versus Harry's over there or anybody else's is that you may not have the same ones as me because you do different activities, right? But the guide of the book can be a really helpful place to look if you, let's say, have radiating pain down your neck. You might find that this trigger point over here actually solves that or makes it go away for X a period of time. And so it can be a very helpful form of therapy that can provide very quick relief. It doesn't necessarily mean that you're going to have long-term relief, but it can start the process of feeling that and then get you feeling better enough that you can start to do work, physical therapy, stretching, other movements, such that maybe it doesn't come back, and sometimes that really quick relief that it can provide is the bridge to you getting better. And so I personally incorporated a fair amount in my work. I'm not known entirely as a trigger point therapist. I'm more of a myofascial release therapist, but there are plenty of times when I'm doing very slow myofascial release and I'll hit a spot that's like a trigger point and I'll just wait and I'll sit there just like I'm doing neuromuscular trigger point therapy, and eventually that starts to melt and move again, and then I'm back into doing myofascial release. And so those two can kind of intermingle with each other really easily and well, and provide a lot of relief and a lot of very focused work for very specific local pain conditions. And so you might see on a menu at a place trigger point therapy if you're dealing with a very local pain condition, carpal tunnel syndrome, rotator cuff tear, knee pain, hip pain, low back pain, any of these kind of conditions. I would say any practitioner who's willing to list that as the thing that they do is probably going to be more likely to give you a lot of relief quickly than somebody, let's say, who's just doing Swedish massage. It's not always the case. That's a general rule of thumb, but in general, somebody who is practicing trigger point therapy is going to be more focused on pain relief than somebody who's practicing Swedish massage. All right. That is somewhat related to and seems very similar to Shiatsu, in that Shiatsu also finds points on the body and presses into them. But the underlying theory between the two is actually super different. It looks the same in practice in some ways, at least in terms of finding a point and sitting there and waiting for it to release. But instead of finding little knots of muscle like trigger points, Shiatsu is based on Chinese medicine and acupuncture. And basically, instead of pressing in with a needle, you're pressing in with your body or your thumb. Thumb usually in Shiatsu, but sometimes elbow, sometimes knuckle. And the basic idea there is, instead of thinking we're going to press into a knot on a muscle and get it to melt and provide some relief locally, that we're going to press into a point and get the qi to move. Whether you buy into Chinese medicine and the idea of energy moving through the body and lines of qi is a whole other thing, and I have some understanding of how that works. I'm not a Chinese medicine practitioner, but that's the difference in how the same idea of applying points and letting points release looks the same on the outside, but is based on a totally different idea underneath. And Shiatsu comes from Japan. It's also generally done on the floor on a mat versus on a table, although you have plenty of practitioners who, because they have a massage license in the state they're in and work in a place that uses a table and doesn't have a floor mat, will do Shiatsu work on a massage table. And so you can have a variety of different ways that this shows up. But there are practitioners who are very traditional that only do floor Shiatsu. It is somewhat like Swedish, and it is also meant for more general health and not for very specific pain conditions. Although there are practitioners who are very advanced who can do much more localized work. Related to that, you've got Thai massage, which has become very popular. Thai massage is also done generally on the floor on a mat, although sometimes traditionally on the beach in Thailand. And it also uses points and lines of energy in the body, but unlike Shiatsu, it incorporates a lot more stretching. And there will be a lot more use of twisting the client's body into different positions and stretches to elongate fascial lines in the body and stretch out those energy meridians. But they do think of it less about stretching muscles and fascia and more about energy lines, just like Shiatsu practitioners. That's the underlying thought process they have in how they evaluate things. The result on your side may be very similar to somebody who's more Western in thought, but I just want to make it clear that what they're evaluating and how they work comes from this more Eastern way of thinking about energy and lines of energy throughout the body. Again, you can have some crossover, but some people are trained just in Thai massage and not in Swedish massage, traditional massage. Especially here in New York State, you do want to make sure that you've got somebody who is a New York State licensed massage therapist. And some people are only certified in Thai massage and not able to practice massage in New York State because they only are trained in Thai. And so, you just want to check into that and make sure that you know what you're getting, because they're not synonymous. Okay, so let's keep going down the list here. Prenatal massage, right? And prenatal massage is pretty much what it sounds like. It's massage for somebody who is pregnant. And there are some myths about that I would debunk right now. So one myth is that you can't get massage in the first trimester of pregnancy. That's really totally false, and we can go more in depth in a different video on that. But the truth is you can get massage throughout the entire term of a pregnancy. There are some things that you have to change about how you work with somebody who is pregnant, and somebody who you should make sure that your therapist knows what those differences are and is trained in those things. So that is one of the reasons that actually one of the few menu items that we have different at Bodyworks DW is prenatal massage. That is something that we want to make sure that we know that you're pregnant before you come in, so that we can just make sure that we have a therapist who actually has the training and experience to work on you. And so there's a place where we do make one distinction in our menu versus the rest of the other styles where we don't. So then there's this really popular trendy style in the last, let's say, 5 years, lymphatic drainage massage. The origins of it are ancient, but it really became in vogue sort of a century ago, and then maybe 50 years ago. It is something that's gotten super trendy, and a lot of people are doing it for reasons that, quite frankly, are unnecessary. And this is just an opinion. I'm sure there's plenty of people who will disagree with me. It's actually a really good article that I was I read today on my way into this shoot from National Geographic that was really good and balanced, talking about when it makes sense to actually get lymphatic drainage and when it really doesn't make any difference whatsoever. And so the origins of it are for oncology, for somebody who, let's say, went through cancer surgery and for some reason or another, their lymph nodes were impacted by the surgery, either cut out or the scar tissue from the surgery actually prevents the lymph lines from moving through. And lymphatic drainage can help the person recover and move through. Also, when they're going through chemotherapy, that system itself can get really bogged down and use some support. And so in that context, it can be really helpful. Also for, let's say, somebody who is very old and has skin and muscle tissue that is pretty deteriorated and can't really use a lot of pressure at all, lymphatic drainage massage can absolutely help them feel better without damaging the tissue any further. However, if you're a perfectly healthy adult with normal health who's exercising normally, lymphatic drainage massage probably won't do much of anything different for you than, let's say, going to the gym and having a workout or walking around the block. And a normal massage will probably move your lymph through the system just as much as anything, and so I do want to make that distinction. I'm sure there are instances where people would disagree with me. It's becoming super in vogue for people to get post liposuction, which probably does make a difference in that context. And it's also something that I'm not personally trained in. So just so that we make that distinction and I get very clear about it. And so again, if you're a major practitioner of it and you want to come on and comment about when it's good to get and good for a client to use, then by all means, come on. It's not my forte and not my field of expertise, but there are plenty of use cases where it's absolutely wonderful and like the best thing for clients. And then I think it's also become so trendy that a lot of people are getting it who don't really need it. And that's all I'll say about that. It's very, very light work. I said that's all I'll say about it. I'll say a little bit more. Just to distinguish, it's very, very light, surface level, almost like this kind of work. And correct me if I'm wrong, other practitioners. And the goal is, because the lymph system sits right under the skin and not in the muscle tissue itself, that instead of getting deeper into the muscle tissue, you're really trying to get just below the skin layer and move the lymph through the system. And again, if you're somebody who's expecting to get a deep tissue massage and you come in and get something like that, I just want you to know that that's what that means. Okay. So then we have this broad bucket term of medical massage, which can refer to all sorts of different things. And basically what I would say about that, because it's a little ill-defined as a term, is I would say we practice medical massage here at Bodyworks DW, and I would make our definition of it as results-based massage, meaning we practice mostly pain management and issue-based work. You have neck pain, back pain, you tore your rotator cuff, you're recovering from knee surgery or hip replacement surgery, or you have a disc herniation, either in your lumbar or your cervical disc. Those are all issues that I deal with. Plantar fasciitis, carpal tunnel syndrome. Those are all medical conditions, and they're all things that actually we can do a lot for with advanced massage therapy. And so that's how I would define medical massage therapy. It can use a lot of different techniques. And again, we're sort of really covering the idea that these terms, some of them refer to very specific techniques and others are large buckets that kind of cover a lot of different things. And so medical massage is one of these large buckets. So it could refer to trigger point therapy. It could refer to deep Swedish. It could refer to myofascial release. It could refer to sports massage, even in some contexts, right? But the general way that I would distinguish medical massage from those other things is that you're looking to produce a result in pain management. And that you're using those different techniques to produce that result. Okay, so then we get into a different technique entirely, which is myofascial release, which is my main technique that I use as a practitioner. I use trigger point, I said. I use some Swedish. I use plenty of deep tissue Swedish and some sports and some a little bit of this, a little bit of that, lots of stretching in my work. But the main thing that I'm known for is myofascial release, which is based on Rolfing or structural integration, which are both all sort of the same bucket of ideas. And in general, what we're really looking for here is that we're stretching the connective tissue, not just the muscles. Fascia is the stuff that glues all your tissues together. And it is, there's layers of it between the skin and the muscles, big, thick layers in some places. There's also layers between each of the muscles, and then each muscle fiber itself is wrapped in some fascia. So it's sort of woven throughout your body. And when you apply slow, deep pressure to fascia, it slowly liquefies and gets softer. And that will allow the tissue to stretch and expand. And it is a little bit more permanent of an effect. Not, I should say semi-permanent, because it's really, there is no permanent effects in the body. But it is a longer term effect than, let's say, just a rapid Swedish massage. However, a rapid Swedish massage might feel really nice when you're getting it on the table during the 60 or 90 minutes you're on the table. But then you walk out and 2 hours later, you feel just like you did 2 hours ago. With myofascial release, it's a little less comfortable on the table. However, you will last, well, the results of the sessions, given the experience of the practitioner and their training, in general, will last anywhere from days to weeks to even months, depending. And if you layer sessions on top of each other in a series, you can really get months to years of results out of the work. And that's basically what I'm known for, what our studio is known for, is creating a series of sessions such that not just the individual sessions will produce results, but they basically layer on top of each other, and there's a cumulative effect such that by session 5 to 8, you're really looking at 6 to 12 months of relief to even years of relief. And that's really kind of our work and how we sort of do things at Bodyworks DW. On the other hand, I'm not a Rolfer or a structural integrationist myself, and I sort of sit in the middle of that and traditional massage therapy and mix in a lot of other things with my work. So then there's one more on my list, which is structural integration. I just want to make clear that that's really just the same term as Rolfing. Ida Rolf, who invented Rolfing, hated that it was named Rolfing after her. Her term was structural integration. So if you ever see those terms, they're really the same thing. And myofascial release is technically somewhat tangential to that. It's a little broader. It's not quite all under the same belt as Ida's work. But they are all basically based on the same set of techniques of contacting the tissue deeply and then waiting for it to very slowly stretch and release, which can feel slightly uncomfortable, and although it usually feels like the right things are happening when it's happening, and then can provide a lot more longer term relief and longer term effects. So again, those are all of those styles. And then you have all sorts of the spa menu-y kind of things like hot stone massage, which to me is just super gimmicky. It feels really nice. They heat the stones up in a little warmer and they place them on you. And look, I'm a fan of hot stuff. I have all sorts of hot packs at home, but I'm also the kind of practitioner that's like, why would I do something for you for $200 an hour, which is what my rates are, $205, that you could do for yourself at home? I'm not going to like Theragun you on my table or put hot towels on you when you could go home and heat some towels up and put them on yourself for free. Right? So I'd rather do something that's a lot more like something only I can do for you. But hot stones feel nice. Sometimes they will use the hot stones as tools to kind of work the tissue. Great. Just not my cup of tea, but it can be nice, trendy. It's a little bit more of a spa experience. And then sometimes you'll see even stranger stuff like, moon massage or some names like that, which really are just something the spa came up with to brand the thing in something to make it special and charge more. And I have no idea what it means. And you probably don't either. So that is, again, very confusing when you go and open up a website, or if you get to a spa or you're visiting somewhere and you look and they've got 3 pages of these different things and you're like, what do I choose, right? So here at Bodyworks, we really don't want you to have to go through that experience of, I don't know what to choose. As much as we can, we still have some choices you have to make here, like which therapist do I choose? What day do I want to come in? Do I want 60 or 90 minutes? But we really try to make it that simple. Do I want 60 minutes? Well, or do I want 90 minutes, right? And really the difference there is in 60 minutes, we can absolutely do a lot. We can get your pain to come down, but sometimes it will feel a little bit like we pulled you apart and then sent you home to put yourself back together, which you will enjoy because you'll actually feel better for a lot longer after that than a normal massage. With a 90-minute session on my table, it will feel a little bit like I pulled you apart for 75 to 80 minutes and then took 10 to 15 minutes to kind of integrate it and put you back together again. So it's a little bit more of a walk out of the studio feeling complete experience. And it also can feel really nice to get 90 minutes for the very first time that you come in, so that we have a little bit more time to do a full intake, a little bit more time to cover different areas of the body. But if you're unsure which to choose, I always say this to clients: if the choice is 60 minutes more often or 90 minutes less often, whether it's a budget choice or a scheduling choice, I would tell you to choose 60 minutes more often, because work that's layered closer together has more of an impact than work that's spread out, and if it's the choice of coming in and seeing me for 3 to 5 60 minutes, 1 to 2 weeks apart for, let's say, 2 months, and then not seeing me for a year, or seeing me for 90 minutes every 2 months for a year, that first choice of the 60 minutes and then not for a year is going to be way more impactful. You're actually going to get way more out of that experience. You're going to feel much better by the end of that year than you would with the 90 minutes that are spread out. And that's just the way that I've seen it happen for thousands of clients over my career. So that just gives you an idea of like how to help make those different choices. But again, we don't have a whole menu of these different styles for you to choose from. What we would tell you is pick 60 or 90 minutes, pick, a senior level or a lead level, or me, the owner level therapist, depending on how severe your case is. So if it's like a crazy case with like a full hip replacement and multiple other issues going on, or some really rare genetic condition with like scoliosis and like, I also had some surgery where they carved out bones of my legs and reshaped them, which I have had clients, at least one with that actual storyline. Then yeah, come see me. I've probably got the most experience to not like balk at your condition at all and actually comfortably work with you. Our lead therapists are also very experienced and can deal with almost anything that you throw at them. And our senior therapists are actually quite experienced. But if you're a little unsure, maybe you go with the lead therapist over them. However, the senior therapist can deal with neck pain, back pain, knee pain, any of the normal stuff that you might have on a daily basis for sure. And they're certainly going to be better than most therapists you're going to run into. And so that might help you figure out what to do with our choices on our website. But again, we absolutely don't want you to have to think about deep tissue or Swedish or sports or myofascial release. And in fact, what we're going to tell you is don't think about any of that stuff. tell us what's going on with you. We will look at you, evaluate your posture, talk about your history, talk about your injuries, and then we will make a plan and involve all of those different styles to whatever degree we think we need to get you the results that you want to get. And if that means that on a given day we need to add a little bit more trigger point to get something done, then we do that. If that means we need a little bit more myofascial release, we do that. If on a given day you're like, actually, I'm feeling really stressed out, I want something more relaxing and tonifying, then we can adjust to that and give you a little bit more Swedish, and that's also fine. But basically, you tell us what's going on and we design the session custom for you. And that's how we do it at our studio. So hopefully that helps clear up a lot of these different styles. If you have any questions, or additional ideas or thoughts that you want clarification on, by all means, drop a comment below and we'll be happy to answer anything. If you want to fight me on any of my opinions, go ahead and drop a comment below and we'll see how that goes. Now that I've explained how our menu here works, if you're in New York City and you're dealing with any kind of a pain relief issue, like any of the number of things that I've mentioned, we definitely can help you. So if you go to our website, bodyworksdw.com, pick out 60 or 90 minutes. If you're really in acute pain, by all means, pick anybody on our staff and come see somebody as soon as you can. If you aren't in acute pain and you have a really complex case and you want to wait 4 to 6 weeks, come see me. If you want to wait a week, come see one of the lead therapists, and so on and so forth. But we would love to work with you, and we definitely can help you. So hopefully we'll have a chance to work together. Have a great day.